Hello and welcome back to Medical Minds, where we bring you in-depth medical insights and latest health research. Today we will exploring a magic mineral and its profound effects on glycemic control and insulin sensitivity. Whether you are managing diabetes or aiming to maintain stable blood glucose levels, chromium plays a crucial role. In this video, we will break down how chromium impacts your body, examine the latest studies, and explore its potential as an adjunct in diabetes management. Chromium is an essential trace element required in a small amount by the human body. It is pivotal in the metabolism of macronutrients, particularly carbohydrates, by enhancing the action of insulin, a key hormone in glucose homeostasis. Chromium exists in several forms, with trivalent chromium being biologically active and found in food and supplements. This form is most important for potentiating insulin action and facilitating glucose uptake into the cells. A chromium deficiency can lead to impaired glucose tolerance, insulin resistance, and subsequently hyperglycemia, which is a hallmark of diabetes mellitus. Chromium's role in blood glucose regulation is primarily through its interaction with insulin receptors. Chromium enhances the tyrosine kinase activity of insulin receptors, which leads to increased insulin sensitivity. This process allows for more efficient glucose transport into cells. A study published in the Journal of Clinical Endocrinology and Metabolism illustrated that chromium supplementation improved insulin receptor function in patients with type 2 diabetes, thereby reducing fasting blood glucose levels and HbA1c, a marker of long-term glucose control. The therapeutic potential of chromium in diabetes management has been the subject of numerous clinical trials. In a randomized controlled trial published in Diabetes Technology and Therapeutics, chromium supplementation was associated with a significant reduction in fasting glucose and postprandial glucose levels in patients with type 2 diabetes, suggesting its efficacy as an adjunct therapy. Moreover, a study in the Journal of Trace Elements in Medicine and Biology found that chromium picolinate supplementation not only improved insulin sensitivity but also reduced oxidative stress markers, which are elevated in diabetic patients and contribute to vascular complications. Some evidence suggests that supplementing with chromium may have other benefits like improving blood cholesterol levels and supporting weight loss, though research is ongoing in these areas. Having high blood cholesterol levels has been linked to low levels of chromium, so researchers have been analyzing whether chromium supplementation could help. Some findings indicated that chromium did not have a noticeable effect. Other research suggested that daily chromium supplementation significantly lowered triglyceride levels and total cholesterol levels and increased HDL cholesterol. Preliminary evidence has suggested that chromium's interaction with insulin activity might be useful for supporting weight loss and increasing lean body mass, and could potentially reduce factors like food intake and hunger levels. Several recent research reviews have found that taking varying amount of chromium supplement daily help reduce body weight and body fat percentage in a small but statistically significant way. A chromium deficiency can precipitate or exacerbate insulin resistance, a precursor of type 2 diabetes. Population most at risk for chromium deficiency include the elderly, those with diets high in refined sugars, and individuals undergoing excessive physical stress or trauma, which increases chromium excretion. Clinical manifestation of chromium deficiency include hyperglycemia, hyperinsulinemia, and dyslipidemia, conditions that increase the risk of developing cardiovascular diseases. In a study published in the American Journal of Clinical Nutrition, researchers observed that individuals with low serum chromium levels were more likely to have impaired glucose tolerance and higher insulin resistance. While chromium is available in a variety of foods, the amount present is often minimal, and the bioavailability can be influenced by several factors, including dietary composition and the presence of certain phytochemicals that inhibit absorption. Key dietary sources of chromium include broccoli, which contains approximately 11 micrograms per half cup serving. Grape juice contains around 8 micrograms per cup. Whole grains, which is considered as reliable source, though processing can significantly reduce chromium content. Brewer's yeast, one of the richest sources, containing up to 60 micrograms per tablespoon. For individuals unable to obtain sufficient chromium from diet alone, supplementation may be necessary. Chromium supplements such as chromium picolinate have been shown to be effective in improving glycemic control. A meta-analysis published in Nutrients concluded that chromium supplementation significantly reduced fasting blood glucose levels and improved HbA1c in individuals with type 2 diabetes. Chromium supplementation is generally considered safe when used within recommended dietary allowance, which is 25 to 35 micrograms per day for adults. However, higher doses, particularly in supplement form, should be approached with caution. Excessive intake of chromium, particularly hexavalent chromium, which is toxic, can lead to adverse effects, including renal impairment and potentially carcinogenicity. Before starting any chromium supplementation, it is imperative to consult with a healthcare provider, especially for individuals with pre-existing conditions or those taking medications that may interact with chromium. In conclusion, chromium is crucial in managing blood sugar levels and improving insulin sensitivity, making it an essential mineral for those looking to enhance their metabolic health. The research we have discussed highlights its potential benefits, particularly in individuals with type 2 diabetes. As always, it's vital to consult with a healthcare provider before starting any supplementation regimen. For those interested in diving deeper into the science behind chromium and its effect on blood glucose level, I have included links to all the studies and references mentioned in this study in the description below. Make sure to check them out for more comprehensive understanding. If you found this video helpful, don't forget to like, share and subscribe to Medical Minds for more expert content on health and wellness. Stay informed, stay healthy and